Dynamite Chad in the morning in here with you on this Thursday, joined now by our guest with not only the Tipton County Health Department, let's just say the Tennessee Department of Health, and that is Tina Boam, because how many counties are you the director of the health department?
I have 3. I have Fayette, Tipton, and Lauderdale County.
Fayette. I keep saying Haywood, I think, when I was promoing, and it's Fayette.
Yes,
so
it's Fayette.
That's my mistake out there. But so Fayette, Tipton, and Lauderdale. Now, how does it work that you end up with all 3 counties?
It's just how we're divided up into the rural counties. So the health departments cover, well, the rural counties we cover in between the Tennessee River and the Mississippi River, minus Madison County and Shelby County. So there's about 8 of us that divide and conquer between that region. A couple of us have 3 counties and a couple of us have 2 counties. So,
okay.
Yep.
And so now the health department, of course, has an establishment in, I guess, all 95 counties.
Yes.
And what overall is the mission of the Tennessee Health Department as far as, I mean, we all hear about the health department all the time.
Yes.
But there is a purpose for this taxpayer-funded organization.
Yes, we so the mission for TDH is that we promote and protect and improve the health and well-being of all people in Tennessee.
And so I know that you do a ton of stuff,
Yes.
and so you offer things. And I was just talking in the last segment because there was a study that came out that basically smoking in midlife can lead to more likelihood of dementia later in life. Mm-hmm. And I know that one of the things that you guys offer is quit smoking programs through the health department.
We do. We have a smoking cessation program that they can come and sign up, and we will follow up with them weekly. We do have some incentives for that as well. So, gift cards and different things like that, but just basically trying to help them and coach them through how to quit smoking. We do a lot of promoting during the pregnancies as well to do that quick line. There is a quick line that you can call, and we can give all kinds of information out for that through the Tennessee Department of Health or any of your local health departments.
What do you think the thing that most people just misunderstand or don't know that the health department does?
Well, I think some of the common misconceptions of that would be that we only do like STD testing, that we only do vital records, because everybody's like, oh, we can go pick up our shot records and get your birth certificates and death certificates, at the health departments, but we do so much more. Tipton and Lauderdale counties both have primary care, so we can see the uninsured and underinsured patients. Tipton County also has a dentist. My dentist, Dr. Willie, has been there almost 48 years.
Really?
But our primary care, we promote, we have 2 nurse practitioners that are phenomenal, that are there Monday through Friday, 8 to 4:30, that will see our patients. We have WIC education and nutrition. So that's when the mom and new baby and the infants come and see a nutritionist to talk them through the right foods to choose and formulas when the babies are born and things like that. Tipton County is very blessed to have a registered dietitian that's in that position. We do all kinds of things. We have social workers, we have chant workers that take care of the kids to try to find resources that the community needs.
And you guys recently did a back to school thing.
We did. It was phenomenal. We actually have health educators in all 3 of my counties. Well, actually all the counties, and they really promote and get out there into the community and try to educate what the health department services are. And we just had a great time for that back to school bash with, the chamber and beautiful Tipton and Tipton Prevents and all of our community partners that came out to help promote that.
Yeah, and of course, there are a lot of different nonprofits and stuff put on, but I don't think people knew as much. We try to promote as much as we could, but people don't know how organizations like this put back into the community. Mm-hmm. A lot of times, I think that people view it as 2 different things. Sometimes, like you said, I do think the STD thing. I think people think that is where you get tested for that, and that's about the fun, and that is what they do. They do offer that, but I think that's one way that people think of it. And I think another way that people think of it is as a government agency and not something that is street level service,
Mhm.
that it's more of some kind of government oversight agency,
Mhm.
which couldn't be further from the case.
Correct. Yes, we just, we're here for the community to take care of everybody, to make sure that they're healthy and taken care of. And I know that a lot of people, when people ask, if I ask those questions, especially to when we have groups come and tour and things like that, it's always like the first thing that they say, that that's all that they know that we do is the STI testing. But of course, that's an important part of taking care of everybody's overall health.
Right. And, there are things, flu shots. I know you
Oh, yes.
guys have programs for that. I'm sure now we have programs for COVID through the health department
Mhm.
as well. There are combo vaccines now, I think, for that. But all of your different vaccinations and stuff, you guys are able to do.
Yes.
Hep testing, hepatitis testing,
Mhm.
which is a thing and it's one of so you can't just get that everywhere. And that's another thing is you
Right.
can't, that's one of those things you can't really just go to your regular doctor and get the Hep B vaccinations.
Yeah.
And not, at least not always. I probably there's some doctors that do it, but the place I know to do it is the health department.
Yes.
And so you guys offer a lot of stuff like that. So with school starting, what services are families most interested in right now?
So getting shot records, because they have to have those shot records turned into school for registration. We do all their immunizations that are due, even if they are behind. We can catch them up on those immunizations. We a lot of the medical schools or nursing programs have to have like a TB testing to get in, so we do that and read that testing for them as well. And I know you mentioned the hepatitis, but I also want to mention that the health departments actually do breast and cervical cancer screenings. And we are launching things for colon cancer as well and lung cancer. So we have that ability to do so. We just have there's so many resources in the health department that we try to be that informational hub for all of our communities so that we can give that information and be able to do those services for everybody.
So when you go to get any of these numerous services, what costs are involved to the patient, and when does somebody need to make an appointment versus when they can walk in?
So we prefer appointments, but we are a walk-in service. So you can walk in at any time to do that. But of course, if we have an appointment, those come, it's our priority for that. But we will serve anybody who walks through the door until 4:30.
And so is it an anybody thing? Like, is it insurance, or is it, do you guys take insurance? Is there co-pays? How does all of that function within the health department?
So we do take some insurances, but our main priority is the underinsured and the uninsured community members.
We're all underinsured, but
Yeah.
no, I know what you mean. And of course, usually you pick your own doctor and stuff when you have your health insurance you don't pick your own doctor, you pick out of their list, but
right.
But yeah, so if you are uninsured and you come to the health department, let's say, is it an income thing?
It is. It's on a sliding scale.
Okay.
So they do ask that question, and I mean, you could pay a copay as a minimum of $10.
Okay.
Mm-hmm.
All right. Excellent. Well, when we come back, we'll talk some more with you. I got Morgan Wallen right now, and we'll have more with health department lead of 3 counties.
US 51 country 93.5 FM.
Dynamite Chad back in here with you, joined by Tina Boam, the director of Tipton County Health Department, Lauderdale County Health Department, Fayette County Health Department. They are spread thin, buddy. And it is crazy because in trying to get in touch with you, it's every time I called a health department, they would say, she's not at this one today. And so it was like bouncing around until, finally what happened is somebody took a message and just gave it to you.
Yes.
Because it's a really demanding job that you have going back and forth. And you're just telling me some of your background, that you were a paramedic for a while, which I worked on an ambulance before as well. And so you had experience in emergency medicine before you got into the field you're in now. You worked some for the Med, which is now Regional 1. And so just kind of tell me a little bit, or tell the audience rather, because we talked about it a little bit, but tell the audience a little bit about the steps it took to get where you are now with your job. Like what led you to this position?
It was an awesome opportunity that came up. I worked at Regional 1 for almost 17 years in the burn center. Absolutely loved working in the burn center, but this opportunity came up, and it was time to move on in a different part of my career. So it just a great opportunity to do a different type of health services for the community. So, Regional 1 takes care of, underinsured, insured patients too, but just moving into that base of community into rural health and really trying to promote the services that the health department has and kind of move into that direction, which is very rewarding every day.
The burn center is it has always been like one of the top things in the area, and really I guess you would say the bell cow of Memphis area medical is that the Burns Level 1 Trauma Center, but specifically the Burns Center, very well known nationally. And it's I'm telling you now, for people that have been burned, I've been burned really bad, and it is the worst. And some of the stuff that you have to have done. Now, I didn't have to have this done, but other people, when they're burned very bad, they have to get like scrubbed and stuff while it's unimaginable pain that these people are in. And so I'm thankful for people that do that job, because
they're a great group.
It is crazy, but yeah, they are some of the best. And so you were part of that team for a long time. So that's cool. Now, we're dealing right now with extreme heat in the area, so I kind of want to shift to that because this week we're under a heat warning. I don't think we're under an excessive heat warning, but we're under some sort of a heat warning. I don't know how they qualify all these things, but I do know that we're in heat indexes in the upper hundreds and like 110, 112, and coupled with humidity in this area that keeps sweat from evaporating, we run into a lot of potential health problems with that. So if you could just kind of go through some of the warning signs if someone's outside, what are some of the warning signs that they could sort of self-diagnose that, hey, it's time to take a break?
Well, excessive sweating, of course, is one, but when you stop sweating is a major sign that something else is going on. Anytime you get shortness of breath, but things like that, you get dizzy, lose consciousness if you want as well. But just making sure that you guys are staying hydrated, like drinking. I used to always tell the athletes I used to work with when I was in college that you want to be going to the bathroom about every 30 minutes. And that's how you're hydrated enough when you're doing things like that. So, but finding cool spots to take breaks about, every 15, 20 minutes, especially in this kind of heat and humidity, but really pushing the fluids.
And I have a feeling that because I've been announcing this lane closure on 51 that's supposed to be happening, and I don't think it's happened yet, and I kind of wonder if it's because of the heat and having people work out there on asphalt that they're sort of delaying that project for a little bit just because of this heat. Because
probably a great idea.
If you work outside, I mean, it can get you pretty fast. And we just told the story about the kids that were fishing, and I mean, they were in shade, by the way. And it still affected them to that point. And I'm sure it had mostly to do with hydration.
Yes, absolutely. Just pushing water, anything that has electrolytes in it too. So your Powerades, your Gatorades, things like that, drinking your fluids and making sure that you're staying as hydrated as possible, and kind of watch the signs. Or not really should say watch the signs, but like when the heat is at its most, try not to be outside directly in the sun, but also, as a former burn person, please wear sunscreen.
I'll tell you, I saw, this is years ago, but I was at a baseball game and someone was like getting sunburned. We were sitting out, like not underneath the awning, but out in the sun. And I was kind of jokingly like, oh yeah, you're getting burned. But then blisters started coming up on this person. And I've never seen that from a sunburn before.
That's a 2nd-degree burn.
Yeah, that was it. I didn't know that could happen.
Yes.
I knew you could get cooked pretty bad by a sunburn and it could hurt. I did not know you could actually get a partial thickness burn from the sun.
Yes, you can. And it happens often. You know, you kind of might fall asleep in the sun, or the other things is it could be lotions that you have on or medications that you're taking. Like different things could cause that to get to that severity just sitting in the sun.
And I don't know why, by the way, because I know I just used the term, and so everybody knows 1st, 2nd, 3rd degree burn.
I was proud of you. That was good.
For some reason, the medical profession actually got away from that a bunch of years ago and started with superficial, partial thickness, and full thickness burns. And but yeah, I don't know why, because I think most people still know it as 1, 2, and 3.
Yes.
But yeah, I did not know that was that much of a danger. So yeah, you really have to take care of it. And if you've got, the one thing I learned a long time ago too, is if you have skin that is healing from something and you overexpose it, then you can end up with spots on your skin because it's developing, it's getting back its melanin or whatever. Yeah. And so if it's overexposed to the sun, then it can melanate at a different rate than the rest of the skin, and you can end up basically spotted or scarred in that one spot by not protecting that.
Yeah, we always encourage everybody to wear sunscreen on anything that has scars or anything that has any kind of discoloration on it.
Absolutely. And so what else right now does the health department have that we need to be aware of going on or coming up in the future as we close it out?
Well, let's see. Lauderdale County is having their back to school bash on August 20th. So next Thursday, from 3 to 6. And we're really excited about that. So we're doing still doing school supplies, giving out school supplies for that, offering birth certificates, death certificates, any walk-in services that need to be done. We're just really pushing all of our services and making sure that everybody's aware that we offer our primary care and WIC services, and family planning is something that's very important with us as well. So pregnancy tests and things like that. So just really promoting our services.
Well, I really appreciate you coming in. I'd like to have you again in the future because I didn't get to touch on a ton of stuff that I want to, like, just out of curiosity more than anything for me. Like, I want to know how the health department works with the CDC and situations like the pandemic. I don't think that we still understand everything that went on there. And so there would definitely be more conversations I'd like to have with you in the future.
Sure.
But I really appreciate you coming in today. So thanks so much
for
being here.